Hello everyone, and welcome to this webinar on tools for intersectoral coordination and how to integrate social policies in conditional cash transfer programs. My name is Zapatero, and I am a social protection specialist at the World Bank. I am currently working in the Africa region and supporting implementation of cash transfer programs in countries like Mozambique, Angola, Tanzania, Sao Tome and Principe, and other African countries. And it's for me a great honor to moderate this webinar today. It is very usual to see in social protection assessments that social protection programs lack coordination, that programs are fragmented, or that there is a lack of harmonization of approaches. Concepts like harmonization, integration, coordination come across many social protection strategies and policies. Many countries have currently decided to invest in social protection systems in order to tackle multidimensional poverty. Fighting multidimensional poverty requires contributions and efforts from different sectors. And again, all of these efforts need to be coordinated and harmonized to a maximum extent to make interventions effective and cost efficient. Today we have with us two international experts in this area who will share the experience from Brazil and from Colombia on integrating social policies and tools for intersectoral coordination. Our first speaker is Rodrigo Lofrano. Rodrigo is the coordinator of Conditionalities for the Bolsa Familia Program at the National Secretariat for Citizenship Income at the Ministry of Social and Agrarian Development in Brazil. Mr. Lofrano is a specialist in public policies and management and has a master's degree in business administration. And he has been working for several years for the government of Brazil. Mr. Lofrano will share with us his experience with Bolsa Familia Program and Brazil's Miseria, and mainly related to intersectoral coordination for conditional cash transfers in a federal context. And he will present some of the innovative solutions adopted by Brazil to ensure that vertical and horizontal coordination for a program that now serves about 40 million households. After his presentation, we will have the intervention from Ms. Andrea Leon Lopez, who is the Director of Family and Community Support at the Department for Social Prosperity in Colombia. Previous to this assignment, Ms. Léon was advisor to the Minister of Justice and Law and to the Deputy Minister for Criminal Policy and Restorative Justice. She has a very extensive experience in implementation of public policies for victims of armed conflicts. Ms. Léon is a psychologist with additional studies on international cooperation and project management. She will share with us her experience with Unidos and how a management model was put in place with the objective of facilitating access to existing social programs to poor and vulnerable families. So, with no further delay, I would like to invite Mr. Lofrano to start his presentation. And after the two presentations, we will have 30 minutes for open questions and answers. So please, Mr. Lofrano, thank you very much for joining us, and the floor is yours.
Thank you very much, Eric. Thank you for all the attendees who joined us. Thank you to Andrea, the World Without Poverty Initiative, and the International Policy Center for Inclusive Growth for inviting me and to have the opportunity to share the experience we have in Brazil with the Bolsa Familia Program, Brazil's cash transfer program, and also to discuss a few of the challenges we had and we still have in implementing that policy. Bolsa Familia Program draws a lot of attention throughout the world because mainly because of its huge scale. The program went from almost 4 billion families in 2004 to almost 14 million families in 2014. And also because of its relative success in tackling poverty in Brazil and helping Brazil leave the UN map of hunger. Next one, please. To tackle poverty means to coordinate actions from different sectors, since poverty is classically one of the so-called wicked issues. Next one, please. Wicked issues that require separation or that require different organizations to be solved. Those big issues give rise to arrangements on intersectorality or transversality. Intersectorality is a term more familiar to those to the Latin academical papers, and whereas transversality is a term more present in the English literature. And on the organizational dimensions, it gives rise to the concept of interorganizational arrangements or interagency arrangements as seen in some papers. So this kind of problem, as I was saying, reflects on the institutional dimension and also on the organizational dimension regarding their implementation and their solutions. In order to advance in this discussion in Brazil, we had to find or to use a few concepts from the literature. Our main reference is Professor Núria Cunil Grau from Chile. She brings two concepts that we used here in Brazil. The first one is the two concepts for intersectoral coordination. The first one is the convergence of efforts from various governmental and non-governmental sectors to produce comprehensive and integrated policies that can offer answers to general needs. The second one, it's the coordination of knowledge and experiences into planning, implementing, and evaluating actions in order to achieve integrated results in complex situations. So, as I said, we're talking about complex situations that cannot be solved by a single agency, a single organization, or a single policy sector, but requires the going further, going beyond the boundaries of those classical policy sectors. We're talking also about interaction between organizations from the governmental or non-governmental sector. And we're talking about planning, implementing, and evaluating actions. Actually, next one, please. The concept which we used in Brazil, based on that literature, comprehends three factors or three categories. The first one is the common perception of problems or opportunities. It's really important that different organizations involved with the social protection issues agree on why are they interacting and which common goal they have to achieve effective intersectoral coordination. Besides that, the resources sharing is also fundamental. When I talk about resources, I'm not referring only to financial resources, but also to human resources and information resources as well. And the third factor regarding intersectoral coordination is the existence of joint actions. That is mainly what we think about when we mention intersectoral coordination, the need for planning and or implementing joint actions. But without those two previous factors, we came to realize that intersectoral coordination cannot be achieved effectively. Next one, please. Now, how do those concepts reflect on the design of the Bolsa Familia program in Brazil? First, the Bolsa Familia program is composed by three main dimensions. The first one, the more famous one, I say, is the cash transfer dimension. It aims at the immediate poverty relief, and it's maybe the simpler to understand. But there are also two other dimensions that are not so well known. The second one is the conditionality dimension, which aims at disrupting the intergenerational cycle of poverty by reinforcing access to basic health and educational services. those conditionalities are commitments between the families that benefit from the program and the public sector in order to make sure those families are accessing the basic health and education services. Therefore, children must have school attendance above specified levels and also keep vaccine monitoring up to date. And pregnant women must attend pre- and postnatal checkups, must attend exams and consultations with the health teams. So this is the main focus of my presentation here, the conditionalities dimension of the Bolsa Familia Program. There is also a third dimension, what we call complementary programs, that tackle issues on employment, culture, microcredit, housing, and other factors related to the human capital development of the beneficiary families. That dimension has been absorbed by the Brasil Sem Miséria plan since 2011, the Brazil Without Poverty plan, which was a plan designed to help the country overcome extreme poverty. And next one, please. These three dimensions of the Bolsa Familia program reflect, as I said earlier, the multidimensional character of the poverty issue. So I'm sure Andrea will talk a little bit about the Colombian experience later. These are concerns regarding the multidimensional issue, the multidimensional character of poverty, and the need to establish different actions in different fronts to help tackle that problem. Now, next one, please. As I said earlier, conditionalities are two-way commitment from families to public sector, but most importantly from public providers to families. Actually, by monitoring the conditionalities, it's possible to make visible the social vulnerabilities among families, beneficiary families at the Bolsa Familia Program, and making it visible, making those vulnerabilities visible helps preventing or helps tackling the problems they face, exercising their basic social rights and health and education. The objectives, therefore, of the conditionalities dimension is to contribute to the disruption of the intergenerational poverty cycle, as I said, to identify and act on social vulnerabilities among families, populations, and territories, to reinforce access to basic social services, and to promote equity in those services. Actually, equity is a main value underlying the design of the conditionalities, since it proposes that the most vulnerable families are those which the state should look for and reach out more effectively to guarantee access to basic social rights. Next one, please. The conditionalities design relies on institutionalized universal public systems. There we have an illustration, the Unified Health System in Brazil, the SUS, Unified Social Assistance System, and also the education network. Education in Brazil is not structured as a system or as a unified system in Brazil. Subnational levels are more autonomous regarding that. Nevertheless, it also poses a challenge in articulating or coordinating efforts in three levels, in three government levels in Brazil. So there was a tension between universality within those sectors, which is the main goal of health, social assistance, and educational sectors, and the selectivity provided, or the focus provided by the Bolsa Familia program. It was necessary to advance not only how the different sectors could contribute to Bolsa Familia, but also how Bolsa Familia could contribute to the different sectoral goals. And the main argument to do so was exactly the principle of equity in public services. That is, in order to achieve universality in those policies, we had to face the inequalities in the access to those services, and therefore to target the most vulnerable and the population who was historically aside from those services. Now, next one, please. How did we achieve that intersectoral coordination in the Bolsa Familia program? Or is it feasible to do so? Lucas Silva, PhD student from the Getúlio Vargas Foundation in São Paulo in 2013, carried out a study to identify the sequence of steps through which through which the federal government went to achieve that intersectoral coordination, at least at the federal level. So the first step he identified was the common perception of intersectoral needs that agrees with our previous definition of intersectoral coordination. The second step was the prioritization and agenda setting that was hugely positively affected by a clear political leadership priority established in the federal government. I will speak a little bit more about that later on. After that, there was the need to capacity building within the organizations related to the program, mainly the Ministry of Health, Ministry of Social Development, and the Ministry of Education. That capacity buildings means to adapt existing structures, existing information systems, existing financial dotations or lines to implementing the Bolsa Familia program in a coordinated manner. And also the assignation of human resources to that, creation of different organizational structures and so on. After that, there's an important step called the medium bureaucracy empowerment in the Bolsa Familia experience, which is after first political decision to prioritize the poverty issue, medium bureaucracy took over. The Bolsa Familia implementation had the important support of the career I'm part of, the career of specialists in public management and in public policy and governmental management. An important part of the secretariat established to implement the Bolsa Familia program was made by these bureaucrats. So it was important in the first moment to empower that bureaucracy. Later on, the relationship between the federal government and the subnational levels also helped empowering technicians in both states and municipalities. Not politicians, but are technicians that are responsible for carrying out the day-by-day of implementing the Bolsa Familia program. Next, it's a process of building working practices, still informally, was initiated. Those practices were selected with time, still informally. And what's interesting is to see that even though Brazil is many Latin countries characterized by reliance on formalization before actual implementation of different public policies, what we saw here in the Bolsa Familia case is that the formalization was only the last step for this intersectoral coordination. So only at the end of the process was that the process was actually formalized, was actually written down in rules and norms. Next one, please. The need to monitor compliance with the conditionalities of the program originated a governance arrangement to coordinate these different efforts at health, education, and social assistance sectors, but also the three levels of government. As I said, all those sectors are huge systems and are carried out mainly by the municipalities in Brazil. So, a few requisites to do so were identified. The first one was the definition of focal points. In fact, every municipality in every state in Brazil have a person, a technician, a civil servant, responsible for monitoring conditionalities, and that is true not only for the social development areas or the social assistance secretariats in the state municipalities, but also in the health and education secretariats. Besides that, it was important to define the specific attributes inside the processes and to establish political pacts and the empowerment of technical levels, as I said before. Those political pacts consist of terms of adhesion to the program that are written down by the mayors of the municipalities and the governors, the state governors, exactly specifying those attributions and the need to establish those focal points I mentioned earlier. Also, besides those points, tools had to be developed to implement that coordination. First, the establishment of governance instances, mainly commissions on the three levels of government, where the different focal points participate. Also, coordination mechanisms. Two of them I'd like to stress are the existence of human resources training, the unified training for the three levels of government. It's a structure of training, and also the existence of financial incentives in order to states and municipalities act or achieve performance or minimum performance established by the federal government. That financial mechanism is what we call the index for decentralized management. Actually, that index, that indicator, defines how well the state or municipality is doing in implementing the Bolsa Familia Program, and considering that the federal government sends or transfers financial resources to the subnational levels. So, next one, please. This is the main governance arrangement in the Bolsa Familia Program. We have the three ministries and the secretariats, state and municipal secretariats of the three areas, and inside each one of them we have a focus point. Important to draw the attention to the existence of three different secretariats involved in the Bolsa Familia Program, somehow in the Social Development Ministry. One is the SENAC, the Citizenship Income Secretariat. The other one is the Extraordinary Secretariat for Overcoming Extreme Poverty, which was created with the Brasil Sem Miséria Plan in 2011. And the third one is the Social Assistance National Secretariat. They have different attributions, they have different policies, but they're all involved somehow in those three dimensions of the Bolsa Familia Program I mentioned before. Next one, please. Now, as I said, it was important to establish specific attributions for each one of those actors within a process, an operational process for implementing the Bolsa Familia Program. So what is that process, the intersectoral process? First, the Ministry of Social Development generates what we call the target audience for the conditionalities monitoring based on data of the unified registry for social programs in Brazil, and also on the Bolsa Familia Program monthly payment database, which tells us which families are inside the program at that month. After that, the Social Development Ministry sends that information to the Education and Health ministries in order for them to insert those that data into specific sectoral systems. After that, municipalities can access those systems. Each sector assesses the specific system to register the monitoring data in the specific sector systems. The sectoral ministries consolidate that data, send it back to the Social Development Ministry, which insert that data into the conditionality systems, which is a unified information systems. And also the ministry identifies non-compliant families and applies resulting effects to their benefits, to their financial benefits. Then communicates the non-compliant families about those effects, and establishes a target audience for what we call the family monitoring, which is designed, it's implemented by the social assistance sector, and it's designed to help families, help non-compliant families to overcome the reasons they face to that avoided them to assess education or health policies or systems. And therefore municipalities are responsible for including those families in social assistance services and register their monitoring in the conditionality system. As I'm talking about information systems, next one please, there was an important decision in the Bolsa Familia design whether to implement multiple information systems or a single system, a single integrated system. We decided to respect the specificities of each sector to implement different sectoral information systems, which are the Sistema Presença, the school attendance system in education, the Bolsa Familia health management system, and finally the conditionality systems, SICON. But those systems are still manually integrated, so we cannot speak about interoperability nowadays, since the integration between those systems is not automatic, but there is a specific design for databases that can talk to each other, that allow systems to talk to each other manually. There is also an important diversity of access profiles. There are profiles that are only for consultation of information, and others that are required to insert data on those systems. There was an important definition of information flows between those systems, and a rigorous schedule that should be obeyed in order to different systems work within the integrated process of implementation. And last but not least, the convergence of key identification data. As I said, all those information is based in a unified registry and in a single single identification data for the families and the individuals, which is the NIS, the social identification number generated inside the unified registry. Now, all that relied on, as I mentioned before, the influence, the political influence, the political leadership that established Bolsa Familia as a governmental priority. In 2004, it was created by unifying previously existing smaller scale cash transfer program. After that, the conditionalities monitoring initiated in 2006. In 2009, it was established the protocol for integrating services, benefits, and cash transfers inside the Unified Social Assistance System, the SUAS, which led to the concept of family monitoring. Then, as I mentioned, in 2011, the Brazil Without Extreme Poverty Plan was carried out. We had a normative review in 2012, 2013 regarding conditionality rules. And now, in 2016, we face both an economical and a political crisis that will certainly bring new changes for the design of the Bolsa Familia Program, but we also have the commitment of the current political leadership to maintain and to improve, to continue improving the design of the program, and it includes the coordination of those different sectors involved with the program. Two examples of that are the efforts to reestablish a program for the inclusion in work, in employment program for the beneficiaries, and also a program to focus on the early childhood of beneficiary family, of children inside the Bolsa Familia Program. So both programs, both initiatives require the ongoing intersectoral coordination within the program. Now, where do we go from now? Next one, please. What are the challenges that remain for us? First, I've tried to demonstrate that Bolsa Familia has a consistent intersectoral model with positive results and advanced tools available both to states and municipalities, and a database with a potential to do even more, to go further on helping families tackle poverty. Nevertheless, we still have challenges related to advancing the arrangement to the local level, incorporating the street level professionals into the arrangement. The local level, what I call the street level, is characterized by non-coincident and overlapping jurisdictions or territorialities. It's important to bring those jurisdictions together to find ways to tackle those non-coincidences, and also to convince street-level professionals at all the policy sectors that it's important to target those families and to focus them on their day-by-day service provisions. Also, to integrate social service towards the core, as I mentioned, based on the operational and information elements built, what we call the post-data collection, or what we see in literature referred as case management. We have to build and to continue that process, that intersectoral process, in order to advance to case management, which is not yet completely structured. To improve horizontality between sectors, we still see that the social assistance sector centers or controls much of the tools, the processes within Bolsa Familia, and also to institutionalize well-succeeded multilateral coordination practices, recognizing different contextual and individual aspects, but also overcoming them. In Brazil, we see the culture of depending on the individual action, considering the street-level professionals. We must overcome that. That's important to recognize, but it's important to overcome that also and establish minimum patterns and minimum procedures in order to tackle the problems I mentioned before. I thank you very much again, the World Without Poverty Initiative and the International Policy Center for Inclusive Growth for the opportunity, and I'm available for the questions you have, and I'll be looking forward for the discussion that my colleagues are going to establish now. Thank you very much.
Thank you very much, Rodrigo, for this excellent presentation. I think it has been very enlightening to hear from you on how the introduction of conditionalities in Bolsa Familia has not only achieved to tackle multiple dimensions of poverty in Brazil, but also how this introduction has requested from additional coordination from different sectors and from additional resources, tools, and instruments to make this happen, as you have very well presented in your presentation. Well, as previously said, we will have a set of questions at the end of this webinar, so please stay with us. And now I would like to invite Andrea Leon Lopez to present the case of Unidos and its management model to facilitate the access to social services at a very low level in Colombia. So please, Andrea Leon, the floor is yours.
Thank you, Rodrigo. Thank you very much, and everybody for having us. We will show you the experience of Colombia, which one has been doing for more than around 8 years. Go to the next one, please. As Rodrigo said, for us it's really important in order to have a good coordination to establish a goal. You have to produce something that involves everybody if you want to work together. For us, the goal is that 1 million people overcome multidimensional poverty, and it means that you will find different sectors that needs to work together. And for us, MPI is what we need to aim, and we need that people reach that goal to overcome this poverty. And as Rodrigo showed us in his presentation, you need to have a comprehensive and integrated policy. So this is that we decided to use the MPI as a goal that addresses the job that we have to do. And we have today more than 9.6 million people that is in that condition, and to achieve our goal we must, and I have to underline that we must work together and articulate with government sectors. Directing actions towards this population make us more efficient, and especially on how we achieve this goal that is joint, and we can have better results. When you don't have too much money, you have to use that something that for us is really important, and that is called intelligent austerity. That's how you can use the same amount of money, but to cover more people and areas, and that's what we have to do with the MPI as a main goal to reach. So you have education, you have childhood and youth, you have labor, you have health, and you have public utilities and housing services. From the prosperity, we cannot do everything, and this is what makes us to have the most challenging thing, and it's how to work together as a sector, and how can sector can contribute to reach that goal. Next. Can we go to the next one, please? Thank you. As Rodrigo told you, that the program called Bolsa Familia, and it gathered a lot of people in one program. We have this program called Unidos, that is the strategy of overcoming extreme poverty, and we do special work giving accompaniment to the household and communities seeking to have access to state social supply to improve their living conditions. We accompany every household and community to give them access, especially to opportunities for their own development. We believe that people have their potentials to overcome poverty, but they need just the tools to do that. That's what we do with Unidos. But as you saw before, we need the work of other sectors to achieve this goal that's overcome extreme poverty. Next. So how can we do that? We visit the families, we start with the social accompaniment. We formulate a family plan or community plan, but we have the most important thing in territories that they are called co-gestor, social worker, that do the social intermediation. It means that he or she, especially she, go in their territory to look, to find the supplies based on the necessities that the families have. And then we have all these sectors, as Rodrigo showed you before, that are involved in this goal. You have the ministers, the municipalities, the private sectors, the corporation, and everybody wants to do something. The difficult is how you can coordinate in order that these offers or supplies actually respond with the necessities that the families have. So in the middle you have these people that are the social workers that have to be the point that can balance what the necessities of the families with the offer, the supply that we have in the territory. And that's the part that it's difficult, how you can share resources, how can you join actions in order to optimize those results, just joint efforts. And if you can see the next one, please. In order to achieve that goal, first you have to start being able to know with your capacities and your teaming territory, how many families actually you can combine. Next one, please. Next one. Next. So first of all, we go back. Thank you. So the first thing that we needed to know was with the money that we have with the budget in order to build this strategy. We decided that we are going to combine approximately 1.6 million households. That's equivalent to 4.6 million of people, and being in approximately all the territories of Colombia, there are 1.102 municipalities in total. How can we do that? With our people, the social workers, that are around 7,000 people in territories. Next one. Then we knew that, next one please. Each territory and each community have their particularities. So we have right now 4 different ways to approach the communities and the families. So we have one model that is urban. It means that in the cities, and it's really according with the necessities of the people in just one urban area. We have a model that is called U100, that is especially for the program of the government, the social housing. And we have 2 models from the communities in rural areas and but for ethnic communities. It helps us to, first of all, achieve that goal, but from the particularities of each community, each territory, but being flexible and trying to just suit the different condition of each area. Next one. Next one. So how can we know exactly what the people need and how can we have to work with other sectors in order to achieve the goal? So first of all, we have a family plan. It's what we build with the family. It's a household planning tool that takes place in the family during the accompaniment. Social workers socialize the achievements, status, and the ability of social supply to jointly define the goals from each family, and they assign the homeworks that they have to do. And we have the different dimensions that are aligned with the MPI, and you can see it goes from simple things as the ID and from the health conditions, nutrition, education, the conditions of the household, and until to reach the most difficult thing for the families, that their income and opportunities to get a formal job. So once the social worker can just build with the family and see what actually the family needs, but as well what they're able the family to do by themselves, or what the supplies that the social worker can have from the offer that it's in the territory, and they agree how they are going to work together, what they are going to be the homeworks or the assignments that each of them are going to have. It means the family as well as the social worker. Next one. And we decided to work as well with the community because we believe that the develop and the transformation have to come from the communities. So the community decided what are going to be their plans, and they built a community plan tool which takes place in the community, and it's oriented by the social worker who makes the diagnosis of their needs and, as I said, build a working plan under the community dimensions. And in the slide that I show you the plan, the dimensions are for the family. Here the dimensions are for the community. So all of them who decided to be part of the construction of the plan decide which one of these dimensions are going to prioritize from their community. It can be from health topics, from the territory, from the how to have access to justice and security, and how to organize and have more participation, and how to construct, how to build associations in order to get a better price of their products, or some productive development from the communities that decided to have, for example, maybe one association that where they have crops and they want to sell them to a better price, so but they need to be organized to have more opportunities to reach those sectors and probably those providers who can come and buy them their products. Next one.
Excuse me, Andrea, you have 5 more minutes, please. Thank you.
I'm almost done. And the social supply coordination, the next one, please. Needs, first of all, to know to whom I'm going to give the supply. So we start from the targeting, then we have the demand of the diagnosis, then we look and we seek from those one in the sector that can supply those needs, When the offer from the state is not enough, we can go and look from the private and corporations, and then something that is really important, and it has to be during the whole process, is how to innovate and how to bring innovation solutions that can be part not only from the supplies, but it can be part as well of the coordination and how to be more creative in to work together. Next one, please. This part was what Rodrigo as well showed you, but the most important that I want to underline this is you don't need too much offers or supplies. You need probably less, but those need to be just one action that be coordinated, but especially that each household receive what they really need. Sometimes you can see how different sectors bring a lot of offers to the communities, but actually those are not aligned with their really needs and each territory. Next one. What we offer to articulate, and this is important that you have to offer something to others if you wanted those work with you. You don't have something that can give more value to this cooperation, and probably no one will be part of that. So we have the information, we know, then we can tell others what actually where the families are, what the family needs, and how can we help you to get those goals that the family decided that we're going to be part of the plan. We have two important tools that is called Llave Maestra, where you can have all the information of each family and to know what programs they are having part of, and it means that you don't get always the same program and always the same probably offer, knowing that already be part of different programs. Then we have the territorial operation that show you that do all the intermediation to get the coordination in the territory with the families, with the communities, but especially we can do the follow-up, the monitoring of this process in the territory. And as I told you before, we have the private and corporation alliances with a special portfolio that align the dimensions of the multinational productivity index, and it helps us as well to aim to the same goal and not to having different actions that, as I told you, probably are important but not are what the people need. Next one. Next one. And what or why we do all this, and we just need that people, as I said in the first slide, overcome extreme poverty. So we have a promotion model that needs 3 criteria to be achieved. First of all, overcome the 11 achievements required. Second, overcoming multidimensional poverty. And third one, overcoming the extreme income poverty lines. So we have 3 areas that, at the beginning I showed you, needs the different sectors to achieve this goal. How can we do that? We need different programs, and not only during the process that the family is accompanied by Unidos, but once they are promoting, we need other programs to receive them. As probably you have this safety net for those, but you need others programs that, as soon as they are promoted from this accompanying, can receive more supplies that help us to keep going in the line that they are decided for them, that is to overcome not extreme poverty, but poverty. Next one. Next one. This is the map of Colombia, and you can see that we are in all territories, and it helps us to have the information. It helps us to know actually what are the different needs, and how to approach those territories in different ways. Next one. Next one. And to do this, and we have decided to have a plan, especially for each family, where the social worker have the information and has to a plan for each week in order to know how can be accompanying in a better way each family. Next one. Next one. So each social worker accompanying 15 families or more. First of all, we have to go and see where they are, so we locate the people. Next one. Next one. And according with this location, each social worker decided how to organize his schedule, and we have one group that's come from 50 families, and each court then goes with more families in order to know exactly which one's going to be the plan for the group that is assigned to the social work. Next one. And we want to show you just quickly, for example, how it works. This is Bertilda Rodriguez household. Next one. She will not be accompanied for the social worker, and as you can see, we have a schedule for her family that are going to be 4 visits, and during each visit, the social worker knows exactly what they have to be doing with their family. First of all, you do the characterization, you decide and you formulate the plan, the family plan, and then she will receive 4 sessions, one for education and different topics that you that the social worker decided with the family, and then management and monitoring how can the family is doing their homeworks that were assigned. And finally, we have a session group to see how all the community is doing their jobs, and in that way reach their goal that they propose with according with the plan, the family plan. Next one. With the information that the social worker brings to us, once the characterization is done, we can know exactly what their needs. And we have the information for one of the requirements that we show you that it's aligned with the MPI. So it helps us to see which one has to be the most important things that we have to promote in each community, and to work with other sectors in order to help the family to reach those goals. We do a lot of analysis to see which of the departments or regions needs more help, more supplies, more probably just work together with other entities to reach those goals. Next one. So that's one of the part that we want to show you. Thank you.
Thank you, Andrea. Thank you very much for this excellent presentation. And I think it was very, very interesting to see the type of arrangements and instruments that are put in place in Colombia to make sure that social assistance is provided at a very decentralized level, right? So please, first of all, allow me to congratulate both of you, both panelists, for the excellent presentations. I am sure that this has been very useful for many of the participants in this webinar that are facing very similar challenges in countries all over the world. The presentation from Brazil has been a great example on how to integrate social policies in a federal and therefore very decentralized context. And it was very interesting to see how the introduction of conditionalities to cash transfer programs have been able to target many different dimensions of poverty, but also at the same time, by adding this complexity to the program, it has requested an important amount of coordination and resources. So it was very useful to see how Brazil was dealing with that. And it was also very interesting to listen how vertical and horizontal coordination had to happen and how complicated this can be. And starting by a common understanding of objectives and a common understanding of problems and opportunities so that adequate incentive can be created among the different sectors. And yeah, in the end it was also very, very interesting to hear how technology is becoming more important in this type of programs and how management of information is a key player in the implementation of any type of coordination mechanism. The presentation from Colombia has also been great and has brought a very interesting perspective on how to provide multi-sectoral assistance at a very low level, at the family level, so that every household receives what it needs, and so that the social assistance is adapted in a case-by-case manner. And well, as Andrea has explained, in this sense, the role of intermediation services, social workers is crucial to be able to manage supply side and demand side of social services. And again, we heard here that the role of information systems in this type of interventions is key. So we have seen from both presentations that also from international experience that intersectoral coordination is key to build social protection systems and to implement social protection programs. And it is key because poverty has multidimensional characteristics. It is key because different households have different needs. And it is key because coordination allows to reduce fragmentation, enhance harmonization, and therefore make a better use of the existing resources. So, however, this is, of course, easier said than done. But what we have seen from the presentations is that coordination needs to happen at several levels, and at least at 3 levels. So the first one would be the institutional level, the second one would be the administrative level, and the third one would be more at the level of the citizen or the beneficiary. So at institutional level, we know that horizontal and vertical coordination is needed. And we all have heard about tools like interministerial MOUs, strategic plans, action plans, and all of these tools, right? And here, as previously said, the challenge relies more on defining a common set of objectives that will be translated in those plans, creating the adequate incentives for a joint collaboration between sectors, and operationalizing the different committees and plans that are created at this institutional level. But this type of coordination can only happen if there is a second level of coordination, which is the administrative coordination. So having the adequate administrative systems and capacity is essential. And here the examples of Cadastro Único in Brazil or the management information system for Chile Solidario are very well known and are being replicated in many different countries. Social registries, information systems, harmonized payment systems become essential tools to coordinate supply and demand side in cash transfer and social protection programs. And then we have the third level that has been very well explained in the presentation done by Andrea. And this is the level where the citizen or the beneficiary gets access to the social services. And here we talk about the role of intermediation services, social workers, local offices, one-stop shops, local centers for integrated services, and all of these tools that Andrea has explained in her presentation, right? So obviously there is no one-fit-all solution for intersectoral coordination. We see from international experience that some countries go for a more centralized approach, and other countries like Brazil or Chile go for a more decentralized approach, and even Colombia. So in some countries coordination happens at a very high level, and the programs are being placed under a strong ministry or directly under the office of the presidency. In other countries like Chile, we see that the model is going more to reversing centralized administration and putting in place a management model where local institutions and regional institutions assume the role of coordinators and service providers. And these type of models have shown maybe better inclusion outcomes by minimizing coverage gaps and reducing overlaps. But of course, getting at such a low level also requests more resources. So, you know, as previously said, social protection systems rely a lot on IT and on technology. We have different sectors with different information systems and databases that need to be interoperable so that coordination can happen, right? And we see that there is a proliferation of IT tools that need to be combined with more of a social knowledge like information systems, social registries. Well, this entails operational challenges because social sectors might not always have this type of expertise in-house, and it takes additional coordination to make sure that IT services are adapted to the needs of the social sector. So just to conclude, a whole set of initiatives and tools have been presented by our two panelists for the delivery of social programs. And coordination does not only entail challenges from political or operational point of view, but it also has financial implications that needs to be addressed. And here, creating the right incentives is essential for this to happen. Coordination becomes even more complicated in developing countries where, apart from the internal coordination in government, governments have to deal with coordination of different donors and different service providers, right, or stakeholders. So I will finish my intervention here. I would like to thank again our two panelists for their excellent presentations, and I think we can start with the questions and answers. I have compiled a few questions from the audience that I will address to our speakers. I suggest that we start with one question addressed to Rodrigo, and one question addressed to Andrea, and then one that is for both of them, and then we might have time to go for a second round. So Rodrigo, one question that we have received relates to how Bolsa Familia Program coordinates with the social security system. So I guess that here we talk about the coordination between the contributory branch of social protection and the non-contributory branch of social protection. So what type of mechanisms or instruments are being put in place in Brazil for this to happen? The question for Andrea would be about the multidimensional poverty index in Colombia, and how is it measured and what is the frequency of measurement of this index. And then a question that I have received for both of you is related to the incentive for coordination. So you both have said that additional resources are needed, not only financial but also human resources, in order to ensure intersectoral coordination. So who has the role to make sure that those resources are mobilized? Thank you. So Rodrigo, maybe you can start with the first one.
Okay, thank you, Eric. Indeed, maybe the answer to the first question will help answering the second one, the one that is direct for me and Andrea. But the fact is that most of the Bolsa Familia coordinators in states and municipalities are within the social assistance secretariats. So most of them are part of the social assistance system in states and municipalities. Besides that, most of the registries of the Cadastro Único, the interviews of the Cadastro Único, are also carried out by teams inside the social systems equipments, the so-called CRAS, Reference Centers for Social Assistance. That is a way, and also those Bolsa Familia coordinators are responsible as well for coordinating the conditionalities monitoring, interacting with the responsibles inside the health and education secretariats. So it's pretty much centralized part of the coordination of the program, including conditionalities monitoring inside the social assistance system. Besides that, we have a directive that is established in the protocol I mentioned before, the Integrated Management Protocol for Services, Benefits, and Cash Transfers within the Unified Social Assistance System, that establishes that families that do not comply with conditionalities should be accompanied priority or should be prioritized in the services, in the social assistance services. That means that social workers in Brazil should first look for the families that are not complying with conditionalities, therefore revealing a vulnerability in executing their their basic social rights in order to offer their services. So basically that's the main design that is established today. Of course, when we see the presentation, Andrea's presentation, we see where we want to get, what we want to reach in Brazil. That is going further on those priorities already established to detail the work that must be done along with the families, along with beneficiary families. That is really incredible and really interesting for us to see here in Brazil. You want me to answer the next question as well?
Yes, please, and then we can pass the floor to Andrea. Thank you.
Well, as I said, the fact that the social assistance, the coordinators of the Bolsa Familia are inside the social assistance system make it easier for that integration to take place. Actually, we have an interesting integration with two main areas of the social assistance system. What we call the basic social protection, which is responsible for what would be the family planning here in Brazil. We also have that design of the family plan, just not as much as detailed as Andrea presented. And the second area is the social vigilance system in Brazil, which refers more or less to the community planning as Andrea presented. So I'm not sure if I'm answering correctly the second question, but the first one was regarding the integration with social assistance system.
Exactly.
Right, and the second one. It was directed for both of us.
What?
Oh, we can get to it later. I believe for what I took notes. I believe those were the questions.
Yeah, exactly.
After Andrea answers the questions, we can get back to the discussion.
Okay, so Andrea, please go ahead. Did you get your question? Yours was about how the multidimensional poverty index is calculated for Colombia, and what is the frequency for this calculation?
Okay, from 2012, this kind of measure was implemented in Colombia with the help of the OFI. It was from the Oxford University, and it's measured each year from the statistical center according with different surveys, especially the life quality and the household conditions. We have these results each year just for the national level, and for the municipalities and the regional level we have to use the census, which one is from 2010? Yeah, 2010? No, 2005, I'm sorry. And it's been done each 10 years. And we are in a need to do it from the proximate years. But right now we do proxies with those information to have the results from the regional level. But it's been done each year. We have the results. That's one from the first question. And from the second one, that it's we have what's the cost? We have cost. No, we have who assumed the cost of the coordination. This year, the department has created a new direction that is in charge of the coordination, and it's from what they manage and coordinate of the social supplies, and it helps us to interact with the other entities. Each minister have to design a person who will be the link from the different programs, and this direction is in charge not only from the offer from the government, as well from the cooperation from the private sector, and so you can have just one space when they coordinate all the information, and as soon as we have the families need, we transfer to them those needed so they can actually look for the offer that is required in for each family. So we assume the cost, means it's part of our job, and this direction has been really important for us because help us to coordinate and to have those important like probably social, they have different groups and they work with the other ministers to do agreements and to have probably to achieve and to decide which are going to be the goals that we share, not only from Prosperidad Social, but only, for example, have to be part of the goals that the Minister of Education have. So we share those goals and we have agreements and we sign, if you want to say, like a commitment in order to work together. But that's part of the task that the direction has.
Okay. Thank you very much, Andrea. Rodrigo, before you answer to this second question, I have one more question for you that you maybe want to combine with this second question on who takes the cost for coordination and how are those incentives created. So the question is about accountability. How is intersectoral accountability ensured in Brazil, and which is the entity that provides general oversight? So we know that we have different sectors. Each sector has different goals and responsibilities. So who is the entity that will make sure that all of these sectors are accountable to a common goal?
I will start with the last question. Actually, there are two separate dimensions that should be addressed here. The first, regarding conditionalities, since we have much more standardized procedures and information systems and so on, as I presented, we don't really see the need for a centralized coordination or monitoring by some other agency, for example, the presidency or some office related to the presidency or something like that, which we currently see in other experiences. So regarding those conditionalities monitoring processes, we already have it ongoing. Actually, each ministry is responsible itself, as it's stated in the law that established the Bolsa Familia Program, for their respective monitoring, and the MDS monitors those processes, but does not have hierarchical, any kind of hierarchical power over the other ministries. So we do have a much more equitable horizontal coordination here. Now, for different partnerships established, and there I tried to answer again the previous question. Since there are no procedures, no standards, no rules as detailed as we have for the conditionality monitoring and so on, we did need a strong central coordination. That coordination was carried out by the Secretariat for the Overcoming of Extreme Poverty, the CESEP, which is inside our ministry as well, but which had been empowered by the presidency to do so, to monitor the actions established for each other ministry. So there was a whole different governance model to monitor actions from different ministries, to identify their performance, and to act on the cases where performance wasn't being met. As I said, it required the political leadership to do so. So we didn't have a specific office aside to the president, but we did have her in the case at the time, the empowerment to do so. So the ministry, MDS, had this double role to implement itself, the program, and also to monitor the Brasil Sem Miséria plan and to make sure other agencies were acting as previously agreed. Now, I'd just like to get back to the very first question, that I was reminded that it had also to do with social security and the contributory system, as you mentioned. Actually, contributory benefits are considered in the entry of new families to the Bolsa Familia Program. Their income counts also the contributory benefits that they receive, if so. So Bolsa Familia targets at families that, even though might receive a contributory benefit from for a specific member of the family, they're still below poverty lines and extreme poverty lines. So they're not, they're complementary. The Bolsa Familia benefit does not substitute the income earned from either employment or Social Security, but it complements for those families that are not that are still below poverty lines.
Okay, great. Thank you, Rodrigo. Very clear, very great answer to both questions. I think we still have time for one more question that will be addressed to Andrea. So, Andrea, the question is about urban and rural context. So, is there any difference on how the program addresses poverty in urban and rural areas? And then a second sub-question would be about the social workers. So what is the status of the social workers? Are they civil servants? Are they consultants, contractorials? And who is the entity in charge of employing the social workers? Andrea, can you hear us?
We have the reason because we decided to do the models is because they are designed to have different sessions as well. The way they do the characterization, we don't have the same questions. We have the different approach, as well. We have for the urban more time dedicated just to see which one are the requirements that the family have. And from the rural and from the ethnics, we go more to see how the community can resolve their problems. And the time with the social worker is divided in those sessions, depends from the model as well. From the urban, they do the characterization, but they have the community plan that is designed to achieve the goals that they have in each community that they build with the families in the model, the urban. When they go to the rural, they have to first of all identify which one are the leaders, which one are the necessities, and they prioritize which one are they going to be the dimension that all the community wants to work together. From the second question about the social worker, we just hire operador social, a social operator from the strategy, and they hire the social worker. It's not a civilian, it's a person that is qualified to do the job, and we just require for us have more important, nor if they are a professional or they have any kind of qualifications. For us, the most important thing, they have been working in the social programs, and they can prove that they have been part of other programs related with communities for more than 5 years. And we pay to the social operator, and they pay to them. So we don't hire them directly with us, but they are hired by the operator who is in different territories, and it depends on the number of families that they have to accompany. We decided the number of social workers that they have to hire. But we are in charge of the supervision, and we design the plan that they have to do, as I showed you before, in each week. Depends with the plan that it's designed from the supervisor here at the Léon.
Okay. Thank you, Andrea. Thank you very much for this very detailed answer. I think we are reaching the end of our webinar, so I would like really to thank our two panelists for the great presentations and for the very detailed answers. I think it has been very, very useful for all of the attendees and for all of us participating in this webinar. So thank you again to both of you. We have received other questions that we didn't have time to reply, so those questions would be answered in the platform. And before closing, I would like to invite all of you to answer the survey at the end of this webinar and to join the online community on the webinar series at the socialprotection.org website. So once again, it was a real pleasure for me to be part of the webinar on this extremely interesting topic. Thank you, Rodrigo, and thank you, Andrea, for your great contributions, and good luck in the future.
Thank you for the invitation, and we will be ready if you have more questions. We will be glad to answer them by email if you want later.
Okay, that's great. Thank you very much.